I could only say one thing to a patient that I'm seeing, regardless of diagnosis, it would be this: stay busy. Stay busy. If people would stay busy, that would take care of, I'm not even kidding, 90+% of the disorders that I see on a daily basis in my office, even ADHD, definitely depression, anxiety. I don't see a lot of florid psychosis in the private practice setting. So if I were still at the U, I'd have to probably exclude, people that are hallucinating a ton. But people who are on their medicines and stable, who are living in the community, this would be my top piece of advice for them too. Stay busy. My boss at the U used to always say that people need to be doing something, and that's absolutely true. I've seen this over and over and over again, and I'll give you my favorite examples. Number one, the kid in the summer, whether it's a school-age kid or a college-age kid, who is saying, I'm just so burned out and tired, I'm going to do nothing. Number two is the person who quits their job or gets fired, and then they wind up doing nothing. Number three is somebody who goes on FMLA or SSDI or something like that with a plan to go back or not. So long-term disability should be included in there. And then number four is somebody who retires. The exact same pattern happens regardless of which of those applies to you. All right? And I cannot stress this enough, and I have the exact same talk with all of them. And I say to them, listen, okay, your instinct is going to be, I'm going to take a break and not do anything. Great. I'm not going to tell them jump on it on day one because then you got to no one's going to listen to me, first of all, if I say that. And number two, yeah, you deserve a break. You worked 60 years in the plant. You get to retire. Absolutely. But it's different for everybody, but it's usually right around the 2-week mark. People start to get restless and they start to feel worthless and useless. And then you can already see the symptom pattern depression comes. And then the more in the muck and mire of depression you get, the harder and harder it is to get out. It's inertia. So Newton's law is right. Body in motion stays in motion. Body at rest stays at rest. Absolutely true in mental health care as well. So take a break, but then you have to do something and make a plan. And I always recommend that people make a structured plan and keep themselves to it. I think volunteering is the best thing you can do. Because number one, you're doing something for somebody else, which is so key because we're tribal animals and we need to be social and we need to feel like we're helping the rest of the tribe. Evolution has built that into us. So volunteering is great. You're helping somebody else. It's the best way to get out of your own head and stop the poor me thing. Okay? Number two, if you volunteer, they're going to put you on a schedule like you were working. The difference is that if you call in sick, you don't feel bad, right? But I recommend you don't do that. So if you volunteer at the animal shelter or the hospice or the Boy Scouts, whatever it is, you have a time, you have to be there. And people are counting on you to be there. And even if it's 2 hours a week, 4 hours a week, whatever it is, that gives you something to do. You know on Tuesdays from 2 to 4, you're going to volunteer at the Animal Rescue League, and that's what you're going to do. That is so critical, all right? And the excuses I get are more numerous than the stars, but okay. So I don't have time is one that tends to go out the window because remember, they're not doing anything. But I don't even know what I would do. I don't even know what I would do. I don't know what I like. I don't know what I would do. Okay, I don't believe that, but all right. People are, what they're saying is, okay, I believe it. I always believe what the patients say when they say stuff like that, but they don't really mean that. What they mean is I'm tired, I'm burned out, and nothing sounds good to me right now. All right. So I tell people, listen, sky's the limit, especially if you're volunteering, because then you're not making any money. So if you could literally do anything, what would it be? And I've gotten some funny answers to that, but you can parlay almost any answer into something. So you get some smartass who's like, I would want to play basketball in the NBA. Okay, so we're probably not going to get you onto an NBA team if you're 65 and you've been in the plant your whole life, but there are lots of youth basketball teams at the YMCA and the local United Way or whatever it is, and you could volunteer and be a coach. You could play a pickup game twice a week with your buddies from 3 to 5. A schedule, and you're doing something, and that one has the added benefit of the exercise component, which for those of you that have seen my 3 cures for depression talk, doing something physical is really important as well. So being on a schedule, being busy, but the most important thing is that it's something that you want to do. And whatever that is, and it may shift, it probably will shift. If you wait too long, it just seems to get darker and darker and darker. My own father could not wait to retire, and he retired, and within a month, he had 3 jobs. And we made fun of him for that, but I got it. I totally got it. As a medical student, I was already onto this whole thing, and he was much, much happier in the 3 jobs that he had because he'd gone from being the director of a mental health center and having to make hard decisions to he's just working, and he loved that. And before he died, he was actually looking at joining the TSA because he thought it would be cool to talk to people at the airport. But whatever it is, okay, and a job, maybe that's it. I know we're going to retire and get a job, right? But I'm talking a lot about the retirement people. For the kids, if you can work legally, I think getting a job is a great thing. If you're on disability, you're probably not going to want to, but it's a great time to then get into appointments. So I haven't had time for PT, haven't had time to do talk therapy. You do now, so do that. Stay busy. Make yourself a schedule. For the people who are in the like the SSDI and that whole crowd, I tell people I want you to treat finding a new job like your job. So get up in the morning and shave and shower and put on reasonable clothes, and at 8 a.m. or 9 a.m. or whatever, you're going to get a cup of coffee and sit down at your computer, and you're going to look for jobs. You're going to go out, fill out applications. If it's I'm going to go back to school, you're going to research schools, go to the community college campus and talk to people about that. That is going to be your job. You don't have to do it 100 hours a week. When 5 o'clock comes, stop. You don't have to do it all night long. People will get really into it and they'll do a ton for 3 days and they'll flame out. Not good either. So yes, stay busy, do something, but also keep in mind kind of some boundaries about that. But I'm telling you, keep moving. Whatever it is, keep moving. If you feel down, if you feel stuck, if you don't know what to do, just keep moving, keep going. I have friends that do ultra marathons, and that's what they always say. No matter how bad you feel, you keep putting one foot in front of the other. And I'm telling you, depression, anxiety, ADHD, all of that, you keep trucking through. Obviously, there are many more things that I would recommend that all those people do. But the question was, if I could only say one thing, and it would be that. Stay busy. You won't regret it. There you go.